First, I'll start with the usual numbers. There have been 126,848 cases of COVID-19 in Canada, including 9,102 deaths. 89% of people have now recovered. Labs across Canada have tested an average of almost 48,000 people daily over the past week, with 0.7% testing positive. Currently, Canada is testing more than 140 people for every positive case. An average of just over 400 new cases have been reported daily during the most recent 7 days. Tragically, in many regions of the country, the COVID-19 pandemic is contributing to an increase in drug-related overdoses and deaths. There are indications that the street drug supply is growing more unpredictable and toxic in some parts of the country, as previous supply chains have been disrupted by travel restrictions and border measures. Public health measures designed to reduce the impact of COVID-19 may increase isolation, stress, and anxiety, and put a strain on the supports for persons who use drugs. As you might have read or heard earlier this week, the number of drug overdose deaths recorded in British Columbia has exceeded 170 for the third consecutive month. This represents a 136% increase over the number of deaths recorded in July of last year. This isn't just happening in British Columbia. There are reports of an increase in overdoses in other communities across the country. Yukon reported twice as many overdose deaths in the first half of 2020 when compared with the same period in 2019. Saskatchewan is reporting historic levels of overdoses and overdose deaths, and in Quebec, July saw the highest number of overdose deaths in Montreal in over 5 years. People use substances for many different reasons, such as a means of coping with trauma and other pain. For some, substance use can have negative impacts on their life. We know that addiction is not a choice. It is a treatable medical condition, and that there are many different paths to wellness and recovery. I encourage those in a position to support people who use substances to explore all of the options at their disposal. Evidence shows supervised consumption sites help save lives, connect people to social services, and can serve as a pathway to treatment. Providing flexible treatment options, such as methadone or other opioid agonist therapies, or a safer alternative to street drugs for people with substance use disorders, are also evidence-based ways to help reduce the risk of overdose, infection, and withdrawal. In these difficult and unprecedented times, it is important that we recognize substance use disorder as a health and social issue, and that we treat people who use drugs with compassion and provide them with the support they need. Visit Canada.ca to learn more about what you can do to help save a life, such as recognize and act if you witness an opioid overdose, or change the way you speak about substance use so others feel supported to reach out for help. Check in regularly on co-workers, friends and family who may be living alone or working from home. These actions can help save lives, especially given the compounding public health impacts of the pandemic. Thank you.
Bonjour.
Aujourd'hui, j'aimerais vous parler de l'incidence de la pandémie sur la crise des surdoses mortelles de drogue qui sévit toujours au Canada, mais, comme d'habitude, je vais d'abord vous donner les derniers chiffres. Il y a eu 126 848 cas de COVID-19 au Canada, dont 9 102 décès. Parmi les personnes infectées, 89% se sont rétablis. Au cours de la dernière semaine, les laboratoires du Canada ont analysé les tests de dépistage de près de 48 000 personnes en moyenne par jour, dont 0,7% a reçu un résultat positif. À l'heure actuelle, pour chaque résultat positif, le Canada a testé plus de 140 personnes. En moyenne, un peu plus de 400 nouveaux cas ont été signalés quotidiennement au cours des 7 derniers jours. Tragiquement, dans de nombreuses régions du pays, la pandémie de COVID-19 contribue à une augmentation des surdoses et des décès associés à la consommation de drogue. Certains indices donne à penser que l'approvisionnement en drogue illicite est de plus en plus imprévisible et toxique dans certaines régions du pays, étant donné que les chaînes d'approvisionnement antérieures ont été perturbées par les mesures frontalières et les restrictions concernant les voyages. Les mesures de santé publique visant à réduire les répercussions de la COVID-19 peuvent accroître l'isolement, l'angoisse et l'anxiété et exercer une pression sur le soutien offert aux personnes qui consomment des drogues. Comme vous l'avez peut-être lu ou entendu plus tôt cette semaine, plus de 170 décès par surdose liés aux drogues ont été signalés en Colombie-Britannique pour le troisième mois consécutif. Ce chiffre représente une augmentation de 136 par rapport au nombre de décès signalés en juillet de l'année dernière. La Colombie-Britannique n'est pas le seul endroit où cela se passe. Une augmentation des surdoses a également été signalée dans d'autres collectivités du pays. Au Yukon, 2 fois plus de décès par surdose ont été signalés au cours du premier semestre de 2020 comparativement à la même période en 2019. La Saskatchewan fait état de niveaux historiques de surdose et de décès par surdose et au Québec, le mois de juillet a été marqué par le plus grand nombre de décès par surdose à Montréal depuis plus de 5 ans. Les gens consomment des substances pour diverses raisons, entre autres pour composer avec un traumatisme et d'autres douleurs. Pour certaines, la consommation de substances peut avoir des effets négatifs sur leur vie. Nous sommes conscients que la dépendance n'est pas un choix. C'est un problème de santé qui se traite et il existe de nombreux moyens différents pour parvenir au mieux-être et au rétablissement. On encourage ceux qui sont en mesure d'aider les personnes qui consomment des substances à examiner toutes les options à leur disposition. D'après des données probantes, les sites de consommation supervisés et de sauver des vies font le lien entre les personnes et les services sociaux et peuvent faire partie des démarches en vue d'un traitement. Offrir des options de traitement flexibles ou proposer une solution de rechange plus sûre aux drogues illicites pour les personnes ayant des troubles liés à la consommation de substances constituent également des moyens fondés sur les données probantes de réduire le risque de surdose, d'infection et de sevrage. Dans ces temps difficiles et sans précédent, il est important de reconnaître les troubles liés à la consommation de substances comme un problème de santé et social et de faire preuve de compassion envers les personnes touchées et de leur offrir le soutien dont elles ont besoin. Consultez le site canada.ca pour savoir ce que vous pouvez faire pour aider à sauver des vies, comme à reconnaître une situation de surdose d'opioïdes et à agir en conséquence ou comment modifier vos propos par rapport à la consommation de substances de façon à ce que les personnes se sentent à l'aise de demander de l'aide. Prenez régulièrement des nouvelles de vos collègues, de vos amis et de vos proches qui vivent peut-être seuls ou qui travaillent à domicile. Ces mesures peuvent aider à sauver des vies, en particulier compte tenu des répercussions cumulatives de la pandémie sur la santé publique. Merci.
Thank you very much. Thank you, doctors. We will now open the line to questions. Vous pouvez poser vos questions dans l'une des 2 langues officielles. We ask that you limit yourself to 1 question and only 1 follow-up. For those asking question in the room, we ask that you make your way to the freestanding mic. As usual, we will start on the phone. Over to you, operator.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez, s'il vous plaît, appuyer sur étoile 1 maintenant pour poser une question. And the first question, la première question est de Jim Bronskill from the Canadian Press. Please go ahead. Your line is open.
Hello, good morning, Dr. Tam. There's a new directive out today from Ontario. It suggests a chief medical officer's decision will take precedence over that of a school official in school settings. Should health officials or school boards have the final say over any pandemic school decisions?
I think that's obviously a matter within the provincial jurisdiction. I would always expect chief medical officers to work with school boards But I think there are different legislation, public health acts within different jurisdictions, so that's best answered by the provinces themselves. However, what is completely evident is that schools need plans, and those plans must sort of entail a very good discussion between school boards, teachers, parents, and the public health, local public health jurisdiction as well, and to ensure a return to school that is as safe as possible.
Jim, follow-up?
Yes, thank you, Dr. Tam. Another question for you. Quebec is announcing that people with symptoms of COVID or who test positive for COVID-19 must now isolate for 10 days instead of 14. Do you support this directive, and will you recommend that other provinces do the same, if so?
Yeah, so I think it's an opportunity to just clarify what that infectious period actually is. So with the Special Advisory Committee, we had previously already discussed this recommendation, and it is something that's already been published, and what Quebec has communicated today aligns with the existing guidelines that the Public Health Agency has already published in working with the provinces and territories. So what we're talking about is not the isolation period from the perspective of quarantine. So in quarantine, we're talking about the incubation period, during which time someone could become symptomatic. And that is up to 14 days. And our period of quarantine has not changed to date. What Quebec is talking about is what we call the infectious period. So someone who actually has COVID-19, and if they are completely recovered, they don't have symptoms, and they don't have fever, and it's been 10 days since the onset of the symptoms, our recommendation is that, based on the evolving science, that those who've sort of experienced 10 days post onset of symptoms, asymptomatic, have no fever, can come out of the actual isolation. So a number of other jurisdictions are already doing that. And so Quebec is just joining others.
Thank you, Doctor. Before we move to the next question, Dr. New, could you repeat this response in French, please?
OK. Merci pour la question.
Thank you very much.
Je pense que c'est peut-être un peu de confusion entre ce qu'on appelle la période d'incubation et aussi la période de contagiosité. On a déjà eu des bonnes discussions au sein de la comité consultatif spécial et tout le monde est d'accord, nous autres ici, avec nos homologues de toutes les provinces et territoires, incluant le Québec. Et ce que les données probantes nous a démontré, c'est qu'une personne contaminée avec le virus qui a eu la COVID-19, la période d'être contagieux vers les autres, c'est au moins 10 jours, peut-être 10 jours après l'apparition des symptômes. Ça, c'est différent de la période d'incubation. Et c'est pourquoi c'est peut-être pas clair pour tout le monde, mais pour nous autres, c'est clair. Si quelqu'un a déjà un cas de COVID-19, ils ont déjà plus de symptômes, ils ont déjà en bonne santé. 10 jours après l'apparition des symptômes, c'est possible de lâcher de l'isolement, mais c'est différent de la période d'incubation. Pour nous autres, à la frontière avec notre loi pour la mise en quarantaine, parce que la période d'incubation, si quelqu'un est contaminé mais n'a pas avoir encore des symptômes ou la maladie, c'est la limite pour la période d'incubation, c'est jusqu'à 14 jours.
Parfait, merci, Doctor. Operator, next question.
Thank you. The next question. La prochaine question est de Michel Lamarche de TVA. Please go ahead. La parole est à vous.
Bonjour, Monsieur New. Vous me dites qu'il y a de la confusion, puis je ne suis pas certaine qu'après votre réponse, il n'y en a plus. Donc, si on précise, c'est 10 jours après les débuts d'apparition de symptômes ou c'est 10 jours après les derniers symptômes? Parce que Québec semblait dire quelque chose de différent ce matin.
Quebec seems to be saying something different this morning. Ce qu'on a discuté au sein de la comité consultative spéciale, c'est si quelqu'un tombe malade avec des symptômes, 10 jours après l'apparition des symptômes initiaux, on considère la personne en général plus contagieuse si après 10 jours, la personne est en bonne santé, en bon état. Ce n'est pas après les derniers symptômes, mais le début, l'apparition des symptômes.
No, it's from the
On
beginning of the
considère,
onset of symptoms.
d'après les données probantes à
According
date,
to
que la
evidence to
personne
date,
n'est plus
this
contagieuse.
person would no
Ça,
longer
c'est
be
clair?
contagious. Is that clear?
Les débuts de
From the
l'apparition des
beginning of the
symptômes.
onset
Et c'est
of
différent
symptoms.
parce que si on
This is
parle de,
different
comme on dit
because if you're
toujours, la
talking
période d'incubation,
about the
si
incubation
quelqu'un
period,
s'est
if
exposé
someone
au
is
virus,
exposed to the
ça
virus,
peut prendre jusqu'à
it could
14
take up
jours
to 14 days
d'avoir des symptômes.
for
Ça,
symptoms to appear.
des deux périodes sont différentes.
There are two
Période
different periods. We're
d'incubation
talking about the
et
incubation
période
period.
après, si on est déjà malade avec
Well, and
le
then if you're already
COVID-19,
sick with COVID-19,
l'apparition des symptômes,
the
c'est
onset of
10 jours
symptoms,
après. On
well,
peut
then we wait 10
considérer que la
days
personne n'est
after
plus contagieuse
to say that the
et
person is no longer
on peut
contagious.
lâcher de l'isolement.
And then they can leave
Merci, Dr.
isolation.
Michel. Question
Thank you.
suivie?
Michel, follow-up question.
Bien sûr. Donc, on comprend
course.
que Québec aujourd'hui,
Quebec
avec
today,
cette annonce,
with its announcement,
respecte la science
is
qui a
respecting,
évolué. En
the
attendant,
science
pour
which has evolved.
limiter la
And
confusion
we want
au
to limit
Canada,
confusion in Canada.
est-ce qu'il vaudrait pas mieux
Would it not be
justement
therefore
donner un
better
son de cloche
to
fédéral
be on the same
pour que
page
tout le monde
federally
soit
so that
aligné parce
everyone is
qu'on
aligned?
a l'impression... Moi, vous disiez que
You
certaines
were saying
provinces
that some
avaient déjà
provinces
mis en
had
place ces
already
mesures-là de 10 jours, mais
implemented
c'est la
this
première fois que
10-day
j'entends ça.
measure.
Oui, on a eu de bonnes discussions.
we've
Ça
had
fait
good
quelques mois
discussions.
parce que
Well,
c'est
4
sûr
months ago we
qu'il y a
discussed
la
this.
différence, peut-être confusion
There
entre
may
10 jours et
be some
14 jours. Donc,
confusion in
ce
terms
que
of the 14 days.
je comprends et j'ai compris,
I
c'est
understand this.
parce qu'il y a peut-être la
Because
confusion entre la période
there could be
d'incubation et la
some confusion
période
between the
d'isolement
incubation period and the
après
isolation
l'apparition des
period.
symptômes. Quelques
After the
provinces,
onset
comme le
of
Québec,
symptoms. Some provinces such as
étaient,
Quebec
on dit, plus conservateurs.
were more
Ils ont
conservative,
utilisé les mêmes 14 jours pour
and
la
they used
période
the same
d'isolement
14 days for the isolation
comparé à la
period.
période d'incubation.
And
Mais
the
maintenant aussi
incubation
parce
period. But now,
qu'on est comme on dit,
we
dans une
know,
autre place
because
qu'avant.
we're in a different
Le
place
Québec
than
a
we were before.
annoncé
Quebec has announced
pour le Québec une politique, oui,
for
c'est
its
seulement 10 jours
province,
après l'apparition
province
des
for,
symptômes. On peut lâcher à quelqu'un de
10-day
l'isolement.
period,
Mais il y avait
after
déjà
the onset
quelques
of symptoms.
provinces.
But there already have been a few provinces.
Peut-être, je veux dire, comme par exemple, je comprends la
example,
Colombie-Britannique a
British
toujours
Columbia,
utilisé les 10 jours
that has always
après
used,
l'apparition des symptômes
the
pour
10-day
indiquer qu'une
period
personne n'est
after
plus
the onset of
contagieuse.
symptoms.
Ça, c'est déjà quelque chose qu'on a bien discuté
We've already discussed
au
this
sein de la
thoroughly
comité
on the
consultative
special
spécial
advisory
et ce n'est pas un
committee,
changement.
and there's no
Tout le
change
monde
here.
a été d'accord que
Everyone
la
agreed
période de contagiosité,
that the
c'est
infectious period
jusqu'à 10 jours.
was up to
Mais
10 days.
toujours, c'est comme on dit, c'est le choix des provinces et
It's always
territoires.
up to the various provinces and
À un moment donné,
territories
si
to decide on this.
une province
But
voulait être
if
plus
a province wants
conservateur,
to be more
et ça,
conservative,
c'était le
they
cas
can
avec
have a
le
longer
Québec.
period.
Parfait, merci, Dr. New.
Thank
Upper,
you,
next
Dr.
question.
New.
Thank you. Merci. The next question, la prochaine question est de Maliha Sheikh from City News. Please go ahead. Your line is open.
Thank you. So currently, international travelers coming into Canada have to do a mandatory 14-day quarantine. And of course, this even applies for some travelers within the country. Are we possibly looking into alternative measures, such as completing COVID-19 tests at the airport so that people can get their results within 24 to 48 hours and then they don't have to self-isolate?
So you're correct that we still have a requirement for 14-day quarantine with some exceptions. And that is sort of proven to work as a public health measure. But absolutely, as we look at options going forwards and, sort of reducing the more restrictive measures at the border, how we apply testing in that context is being actively explored. And I think that there was some communication earlier on some of the testing protocols that could be implemented to, I think, initially get us a bit more data on, what happens when we test travelers at different time periods after they enter Canada, to see if those studies will yield us some information that we can then apply more broadly. And so absolutely we'll be actively, looking at those options.
Thank you, Doctor. Follow-up question?
Is there a timeline on this?
Not at the moment, but it's, we actually have to, of course, have collaboration with local and provincial public health and other partners. And it's not just a matter of the sort of public health science, if you like, but also implementation or operational requirements, given how that border is an extremely busy place where you have to sort of look at what is the best site for doing testing as well. So all of that goes into the consideration as we review the options.
Thank you, Doctor. We'll now turn to the room. Première question dans la salle, Lina.
Oui, bonjour, Lina Dib, La Presse Canadienne. Maybe if you could just explain to me, Dr. Tam, because you were in that train of thought now. So it's 14 days of incubation. So why would it be okay to test a traveler after 2 days, and if his test is negative, to let him go out? I don't quite understand the science of it.
I did not say that would be the protocol. And of course, what you just said is the limitation of testing at a moment in time. So there'll be sort of different proposals that people are putting up where you do serial testing, for example. That might be one option that we could look at, not just on day one, but further down the road, just to see what the results might be. So no, we have not landed on any kind of testing protocol at this point, but we're exploring the test parameters and the limitation of those tests. But what you've hit on is exactly the issue, is that if you test someone at a particular moment in time and they're negative, that doesn't mean that they don't have the virus, which is why we still have that 14-day as the strongest public health measure. But we realize that, in living with this virus, as we progress in the knowledge of the virus, but also maybe different testing modalities that will come on board, we need to revisit this issue on a very real-time basis.
Okay. Mon autre question était à vous, Dr. New, au sujet de ces 10 jours-là. Ce que le Québec dit, c'est quelqu'un qui a quand même perdu son sens de l'odorat. Au bout de 10 jours, c'est un symptôme qu'il peut continuer à avoir, mais aussi la toux. Alors, pouvez-vous m'expliquer de quelle manière est-ce que quelqu'un qui tousse, parce qu'il a eu la COVID-19 il y a 10 jours, n'est plus contagieux au bout de 10 jours, même s'il continue à tousser? Et avant que je m'arrête, il y a aussi beaucoup de bruit au Québec en ce moment à propos de la rentrée scolaire et du fait que on interdit le sport parascolaire aux enfants. Tandis qu'ils peuvent faire ils peuvent être dans une équipe de hockey à l'extérieur, mais pas. Donc, j'aimerais savoir votre opinion de santé publique sur ces restrictions pour les activités parascolaires pour les enfants dans les écoles du Québec, alors qu'ils font le reste, mais pas.
What do you think about that?
Question, c'est...
Your first question was...
Oh, la toux, OK.
Yes, coughing.
C'est difficile. En général, ce que les données probantes nous ont démontré, c'est si quelqu'un est tombé malade avec toute une gamme de symptômes, après 10 jours, si la personne est en bon état avec aucun symptôme, on peut considérer comme plus contagieux. Si quelqu'un est encore malade avec des symptômes, peut-être comme tout, il faut toujours avoir une autre évaluation. Ça ne peut pas dire que tout de suite, toujours 10 jours après, quelqu'un peut être lâché d'isolement.
Excusez-moi, mais parce que ce n'est pas ça la directive de Québec aujourd'hui qui est sortie. C'est au bout de 10 jours, il faut que les symptômes soient tous disparus, sauf l'absence d'odorat et la toux. Ça peut être encore là au bout de 10 jours et on est quand même considéré safe. C'est ça la directive de Québec aujourd'hui.
c'est peu, comme dire, plus en détail. Je pense que la science continue d'évoluer. Je comprends maintenant ce que le Québec a fait. On a discuté en général, on a déjà dit au comité consultatif spécial. Ce que je comprends avec le Québec, avec la science qui continue à évoluer. On continue toujours à regarder c'est quoi les données probantes. Je pense qu'avec la science, ça indique aussi que quelques symptômes peuvent durer aussi longtemps. Peut-être, comme dit, le sens d'odorat, peut-être ça peut être là pour plusieurs semaines. Donc, je pense que ça fait partie de la décision de Québec. Et je pense, en fin de compte aussi, c'est difficile parce que finalement, c'est toujours, comme il dit, j'ai déjà dit ça plusieurs fois en anglais, c'est une question de tolérance des risques et aussi la gestion des risques. Et c'est sûr que les autorités de santé publique dans chaque province et territoire, aussi à l'échelle fédérale, avec nos propres mandats et responsabilités, il faut examiner, faire des analyses, des données probantes et il faut prendre des décisions au fur et à mesure pour leur propre population. Donc, je respecte ce que le Québec a annoncé aujourd'hui. Eux, ils ont examiné la science et il dit que la politique après 10 jours, c'est aussi peut-être les personnes qui continuent peut-être avec quelques symptômes peuvent aussi considérer comme non contagieux. Et on peut les laisser d'isolement selon leur analyse des données probantes. Ça va. Oh, le sport. Ça, c'est aussi un enjeu actuel et c'est difficile. Tout le monde, moi aussi, je pense aussi les autorités de santé publique dans chaque province et territoire au Canada. C'est quoi qu'est-ce qu'on peut garder ou qu'est-ce qu'on peut interdire? C'est difficile. Je pense que c'est toujours important d'avoir une bonne discussion entre les autorités d'éducation et les autorités de santé publique. Un autre facteur très important, c'est aussi toujours c'est quoi le taux d'incidence, c'est quoi la transmission dans la communauté? Parce que si on peut toujours regarder qu'est-ce qui se passe dans les autres pays, s'il y a beaucoup de transmission du virus dans la communauté, c'est sûr, c'est pas seulement l'école, mais dans les restaurants, dans les centres d'achat, le risque d'être contaminé avec le virus est beaucoup plus élevé. Donc, ça, c'est un facteur important. Pour les sports, je pense que aussi c'est une bonne discussion parce que ça dépend aussi de comme dire, la nature des sports. Il y a des sports qui ont plus de contact entre les participants et aussi des sports que c'est vraiment plus solitaire. Je pense que je prends un exemple parce que j'aime les sports que le football, je pense qu'il y a beaucoup plus de contact comparé au tennis. Donc, ça peut-être donne une idée, c'est quoi les considérations pour les autorités à considérer, parce que c'est sûr que si on garde les principes, au moins on sait c'est quoi les principes toujours de distanciation physique, peut-être des barrières physiques, qu'est-ce qu'on peut faire pour peut-être garder un certain niveau d'activité dans notre société. Moi, en fin de compte, c'est difficile pour moi. Je sais que peut-être s'il y a un sport, on permet de continuer dans une région et peut-être pas dans une autre région. C'est vraiment selon les meilleures recommandations des autorités à l'échelle locale.
Thank you, Dr. New. Next question, Ian.
Ian Wood, CTV News. Dr. Tam and Dr. New, with regard to airline travel right now, just for clarification, international travelers arriving in Canada are directed to quarantine for 14 days at their final destination, meaning that if you land in Canada from an international flight, you can still travel on a domestic connection. And this is as opposed to countries like Australia, South Korea, for example, where when you land in those states, you are taken to a quarantine facility, whether that be a hotel or something. Is the quarantine still effective if we're allowing international travelers to travel on board packed domestic flights?
So I would just say that Canada has one of the most stringent quarantine measures around the world, and perhaps like Australia. What the requirement is, if you're symptomatic on arrival, you cannot move on. But if you are asymptomatic, and there's screening procedures, including a temperature check, you wear a mask, and you're taking a flight domestically to your final destination, that is our current protocol. We haven't seen any specific data to date to suggest that isn't a reasonable protocol. We would like people to get to the final place of destination and quarantine there, because for all sorts of reasons, I think that is a very reasonable approach. But all those layers of measures, including mask wearing, sitting down, don't move, face forwards, the ventilations on aircrafts, etc., are all there so that that particular journey in flight is as safe as we can make it, and then people arrive. So I think with any layers of measure, it's never 100%, but this is a very reasonable approach. But anyone with symptoms will be stopped at the site of arrival.
Just add to what Dr. Tam said. One of the other important aspects of Canada's approach to people coming in, with our Quarantine Act is that people have to indicate that they have an isolation plan, that, that at their final destination, that they have a sort of a place that they can self-isolate, that there's no one else at risk, and so on. So certainly we've had individuals who've appeared at our borders and they don't have that sort of isolation plan, or there are other people potentially at risk at their final destination. And so those individuals have been put into federal quarantine facilities sort of at the border or close to it. So,
but all in all, we are satisfied with quarantine. People who need a quarantine going on domestic flights, we're satisfied with the regulations being taken right now?
Yeah, with the layers of protection, yes.
Okay. My second question is still on airlines. I believe it was in June that the major airlines in this country indicated that they would be booking adjacent seats. They would not be keeping them vacant, and that has continued through the summer until now. And we are seeing aircraft that are fully loaded traveling in this country. What was the rationale behind the airlines? I know we talk about their ventilation system being so excellent, but, what is the rationale behind it's okay for people to not social distance and sit in, as you know, airlines the seats are very small, very close together. What's the rationale to give the airlines a break on not having to social distance their passengers?
So I'm not sure about giving them a break, because it's not our role to sort of implement those measures.
When I say give a break, I should say, we have directed restaurants across the country, stores, shops. We have made huge steps across Canada to tell all of our other institutions that they have to have people social distance. But apparently airlines don't have to do that. So I'm still confused about that.
So first of all, it's in anyone's mind, it's not very intuitive to think that airplanes are somehow safe, because they are enclosed. People are close together. And so I think what we were looking at was, one, what is the evidence of spread in-flight spread? And there's been very few reports of an in-flight spread of COVID-19. It doesn't mean it cannot happen, which is why layers of measures have to be put in place to reduce those. In public health, we still advocate for physical distancing where you can. But if you cannot, the screening measures, not mixing passengers, try and sit very still, everyone facing in the same direction, seat back in front of you, mask wearing, hand hygiene, are layers of protection. Can we guarantee 100% protection? No, but it's many different layers of protection to reduce the risk. And I think, again, we haven't had a report in Canada of someone who acquired it during a flight. We'll still have to watch it, and we can still adapt our measures. Secondly, it's very important, I think, for individuals to examine their own risks, because I think if you are a senior, if you have underlying medical conditions, you have to sort of think about, well, where did you start your journey from, all the way to, well, exactly what you're going to do at the other end. From, you know, taking public transport, to arriving at an airport, to going, you know, all the way through the journey, you have to think through all the measures. Are you comfortable with the fact that those measures will protect you? If not, really think twice as to whether that journey or that travel is important to you. So there's a personal risk assessment on top of these layers of protection. And I've had very recent discussions with the provinces and territories about, you know, enhancing notification of positive cases on planes. So I think anyone who's traveled should continue to monitor the symptoms, I would say, for the 2 weeks. There is a website. We're going to try and make it more obvious to Canadians of which flights have had a positive case. To date, we haven't had any reports of a case that's been on a flight with someone. Doesn't mean we may not find one, but it has been very rare.
And sorry, just have either of you recommended
one question
to the transport minister or health minister that perhaps airlines should have social distancing? Do you think they should?
I think everyone should attempt as much as possible to get the physical distancing. And I do think that wherever possible to accommodate someone's risk. And, you know, if someone does have underlying medical conditions, if they have certain types of disabilities, try and find a right placing of that person on a plane would be, you know, extremely welcomed, I'm sure.
Thank you, Dr. Tam. Next question, CBC.
Hey, David Thurton, CBC News. This is a question I've had myself, and my colleagues are having as well. What is your guidance for people about wearing masks outdoors? And, you know, what's the threshold of cases before you would tell Canadians to start wearing masks outdoors? Because right now it's just indoors if you can't keep, and of course if you can't keep the 6 meter distancing, and if not, you'll correct me on that.
Yeah, and as with any sort of assessment of risk for a certain setting, it's not a sort of straight number game. So absolutely look at transmission in your community. That's one thing. And have there been cases in your community, and are there lots of outbreaks, etc.? That's one factor. 2 is outdoors is always better than indoors, so we keep recommending that. But even outdoors, I would say, are you able to control that environment to make sure that people are not sort of crowded together? And is it a place where you feel comfortable that others are going to respect those public health measures and physical distancing, except of course to your own specific social bubble? And if any of those things make you uncomfortable and that you cannot potentially physical distance, I would advocate people to wear a mask, and it would be an added layer of protection. But, it's a sort of discussion that we actually have quite frequently at the Chief Medical Officer's table is actually how do we enable Canadians to go through more of a risk assessment process than, here's a hard number that you should follow. But yeah, if you've got underlying risk factors, if you're not comfortable with your setup, even in the outdoor setting, there could be crowds that you can't control. under those circumstances, I think, adding another layer of precaution is a really prudent thing to do.
David, follow up?
Yes. This is from one of my colleagues at CBC Montreal. They're seeing a situation in Quebec where a school that started yesterday has had to isolate 24 teachers because one teacher tested positive for COVID. That instance will seem very alarming to parents who are, either have put their children back in school or might be considering putting their children the next coming days. So is that case surprising to you, or is this just something that we should expect to see and we should be prepared to see as we head back to school?
Yeah, so I think right now in Canada, in the vast majority of in Canada, the numbers and the rate of infection is actually very low. So that is a really key factor. And we will, and I would say that it is expected that we will get some cases in schools because the chances of having a case will be reflective of what's going on in your community. And so people need to be prepared with local public health on exactly what to do when you have a case. So having a plan is the most important thing so everybody knows what would happen if you did get a case, and that people won't be surprised and that they would feel reassured in terms of what will happen. So I don't know what that specific circumstances is, but I think that people should not have a massive knee-jerk reaction and just close everything, but have local public health examine that situation and provide the advice in terms of what to do in that instance. Many schools will have plans in terms of cohorting people in a certain pods or classes. What they will try to do is to limit the impact on that school by those kind of measures, those physical measures, those hygienic measures, the distancing measures, so that they could be as targeted, as precise, as surgical as they can in managing those circumstances. But I can also understand that there is stressful and is anxious for parents. So that requires a lot of discussion in those particular settings to make sure everybody is actually comfortable with those measures. But I think absolutely we're going to expect to see some cases, as we have seen in other countries. The key is to spot those cases quickly, manage those small clusters, don't let them spread, and see if we can't adapt our protocols and live with the virus. And one other thing that I think is really important is to systematically collect some information about schools, cases in schools, whether they're acquired in school or outside of school. Right now, the data suggests that schools are not a major driver for, transmission in the community, but we have to actually get that data and see in the Canadian context. We also have to collect data on schools that have successfully opened, not just report on the ones that have had an outbreak, because you want to learn, well, what made that setting successful in terms of, maybe out of 2,000 schools, you hear of 2 outbreaks. And that isn't necessarily a course to blanket approach to everything. And we will learn a lot. And I think people, I would like to be able to get some of that information in a systematic way to inform policies.
Thank you. We will now turn back to the phone. Operator?
Thank you. The next question, la prochaine question est de Cormac McSweeney from City News. Please go ahead. Your line is open.
Yeah, hi, Dr. Tam. I'm going to go back to the international travel question for a second. Reuters is reporting that Air Canada is planning a voluntary COVID-19 test trial for passengers arriving in the country at Pearson Airport, and that they're looking at the tests, as have been mentioned in other questions. It would consist of a test at Toronto's Pearson Airport, followed up by 2 tests at home, and they hope that the data collected will convince the government to take a more science-based approach and end the 14-day quarantine requirement, or at least waive it and reduce it for people who have successful negative tests. I'm wondering, has the Public Health Agency been involved in any conversations with the Airport Authority or Air Canada regarding this, and whether you would be actively involved in this specific test trial as being reported by Reuters?
Yes, so we are aware of the study, and it's linked to an academic institution, of course, McMaster University. And I think from our perspective, we wanted to make sure that the study is linked to public health, because obviously any findings, any test positives have to be actionable from a local public health perspective. So absolutely. And we are, of course, very interested in the result. And it's in line with some of the kind of protocols I think should be looked at. And just to emphasize that a negative test in this study or this approach does not exclude you from quarantine, but they will find, I think, good. Some of the results will be of interest to everyone in terms of, you know, what actually happens on arrival, the middle of that incubation period, and towards the end in terms of the testing performance and the detection rates, etc. So I think that we all look towards those kind of results with interest.
Yeah, it's Dr. New. I just would add, I think I would probably take a little issue saying that Air Canada is pushing the government or whatever to take a more science-based approach. I would say we've been taking a science-based approach right from the beginning, and certainly we welcome, you know, any studies that would add to the evidence base. The issue of you know, doing tests for arriving passengers in Canada, I think everyone, including ourselves in Canada, we're seized with that, and we're very keen to see what the evidence shows us, because, you know, not to get too much into details, we know that it's possible that someone may be asymptomatic. It might be picked up at sort of, you know, upon arrival. It's always possible, and that's important to know. But we also know that some people might have been infected just maybe shortly before arrival in Canada. You know, the so-called incubation period is up to 14 days. If someone comes to Canada and they were exposed 1 or 2 days before, they might have a negative test at day 0. But if they were to then have a test at day 7, when it's more likely that the viral load is higher, then they'll test positive. And that's all important information for us to know, so that at the end of the day, we can also look at the science and then make our best recommendations in terms of a risk-based approach. Because it's true that 14 days is what we're using as a limit for the incubation period. But it's possible that if the evidence shows that you get a very substantial proportion of people identified as being positive at day, let's say day 7 or so, that could also inform in terms of what might be considered moving forward. Thank you.
Thank you, Cormac. A follow-up?
Yeah, my follow-up is going to be based on the initial remarks from Dr. Tam at the start of this news conference around drug overdoses. You are sounding the alarm about the boost in drug overdoses that we've seen in many provinces, and urging those in power to explore all options to address the issue. And I think, as you touched on earlier in the week, or possibly last week, I don't know, time is all messed up in the pandemic at the moment, but it could include the possibility of decriminalization of drugs. So I'm wondering, has the Public Health Agency itself done any studies about the public health impact of decriminalizing drugs? If so, what has it found? If not, will it? And you've been meeting regularly with your provincial counterparts. Has decriminalization of the possession of drugs come up in your conversations, and what's the feeling amongst your provincial counterparts?
So I think you're referring to a previous press briefing where our minister was also there, and I think you know, at this point, the government of Canada is not considering decriminalization of these substances, and what I was urging was that it is perhaps a difficult policy discussion. It needs societal debate and discussion. It is one element of, you know, a potential multi-layered approach to addressing the opioid crisis. We've heard the Canadian Association of Chief of Police and their perspective. And I do think that the change or shift in the prosecutory guidance, which is moving towards not prosecuting anyone, with a simple possession of drug, unless there were some very specific circumstances, or moves towards, one step in the direction, but that we mustn't forget the multi-layered approach with harm reduction, opioid-assisted therapy, wraparound supports, and everything else that needs to be done, because that is, not in and of itself a magic bullet, but it does, shift, I think, everybody's thinking from a criminalization approach to one which is a public health approach. And I think the public health approach is the right approach. And we should all be working towards that.
Thank you, Doctor. Next question.
There are no further questions. Il n'y a plus de questions.
Thank you. We'll turn back to the room. Kelsey?
Thank you. My question is for Dr. Tam. Dr. Tam, there still seems to be a very high degree of anxiety amongst parents and teachers ahead of the return to school, in part because nobody seems to know what the new routine is going to look like. They don't know what the new classroom is going to look like. They don't really know what they're supposed to be doing at home still before they go to school. And my question is this level of anxiety normal? Should parents be this scared? Or is this just a response to the high degree of unknown that seems to be floating around still around the return to school?
I think it is absolutely normal to feel stressed. I think, you're talking about your kids. And I think as from the evidence perspective, we've been trying to communicate what we know right now about illnesses being less severe in children, and younger children, as far as we know, may not be the key spreaders or not as ready to transmit as adults. But we're still learning about this virus. I think, the level of activity of COVID-19 is under manageable control. We have quite low levels of illness. But that still doesn't necessarily negate all the myriads of questions that are floating through someone's head before school. So I think it is important to have those dialogues and questions answered under your specific circumstances. I know that given more support is needed, I believe the Prime Minister made an announcement just to provide more support to schools so that if there was more to be done, they can utilize that funding to do so, to make the environment physically safer, to look at how you can provide more maybe technical support for kids. It's also important, I think there'll be many perspectives. I think if you're a parent who are working, if you are a parent who have children who have a specific need to be back in a school environment, you might have a very different perspective. And many of those parents will want to be physically back in school, but they will want to be, know what the routine is, etc. So I think in talking to some of my colleagues is, what you want is every school to have a plan, and for people to actually know what that plan is. That will reduce the level of anxiety. I do think that people should expect to come across cases in the school year, because this is inevitable. But to know exactly what happens when a case is identified, that should also reduce the amount of questions. But it is tough to work through. It's a complicated decision, and there's personal choices also in that. And so I think is expected that this is a difficult decision, and that, carefully weighing the risks and benefits and having those discussions is of paramount importance.
And then just as a follow-up on a different topic, it came out this week that the CanSino vaccine trial is not likely to go ahead now because of various disputes. What does this mean for Canada's vaccine response? Is there other projects that we're looking now to partner with or work on or collaborate with, given CanSino doesn't seem to be going ahead anymore?
Well, I think the sort of optimistic outlook is that there's so much research and so much development in this field right now with, definitely over 100 candidates, and now I think at least 8 in phase 3 clinical trials. I think all of you would have heard earlier about, I think, Minister Anand on the move to look at advanced purchasing arrangements with at least 2 of the front-running candidates. We're continuing to pursue all of those avenues, both internationally and domestically. There is one clinical trial that's, within Canada with Medicago. So absolutely continue to pull at all stops. I was actually very heartened to see the positive results in older adults coming out of the Moderna vaccine, which is one that we are looking at very closely and has entered an agreement with. So I think I have been sort of keeping a sense of realism in the Canadian context of, you might not expect this vaccine for quite a few months, but we have to keep reevaluating that situation, and we may be looking at more than one vaccine. So I think that, I guess the bottom line to your question is yes, we sort of keeping all of those options open, and we'll continue to do so.
Thank you.
Thank you. If there's no more questions in the room, that will be all for today's press conference. Ça sera tout pour aujourd'hui. Merci.
That's all for today. Thank you.